Aging is a very complex mechanism. There are multiple causes and mechanisms that are the reason for which we age and we get old. We have no clue really at this time for the reason we age, but for sure the mitochondrial dysfunction is part of the process, and according to the available evidence is perhaps the one that is most commonly present in the pathways related to aging. Mitochondria can be considered as a kind of power plant for cells and thus for our organism. They are in charge of multiple mechanisms, primarily maintaining and keeping maintaining the energy homeostasis, the energy metabolism, and are in this way playing a major role in all the immune system of the organism. They are closely related to maintenance of the redox balance, playing an active role also on inflammatory pathways. I would say that the one that has been most studied to date is the skeletal muscle. There is a very strong link between the mitochondrial dysfunction and the sarcopenia condition, that is the age-related decline of skeletal muscle, both in terms of quality and quantity. And I would say more in general that every tissue and organ that is breathing may be affected by the mitochondrial dysfunction, but at this time the skeletal muscle is for sure the top list of organs in which the correction of mitochondrial dysfunction represents an important potential. Well, it is important to intervene on the biological mechanisms of aging, because we are used to use some really obsolete paradigms in the clinical practice. That is the treatment of standalone diseases, overlooking that every individual is exposed to aging. That is the primary risk factor for clinical conditions. So understanding the reason why we age, we may find targets for interventions reducing the onset of age-related conditions. And in this context, mitochondrial dysfunction, given the pivotal role that mitochondria play in the homeostasis of the organism, may play an important role in terms of prevention and potential for treatment. To me, the most evident clinical manifestation of mitochondrial dysfunction are those that are related to the exhaustion of the organ. So, for example, the frequently seen condition of fatigue in aging individuals, or every kind of weakness of skeletal muscles that might be accompanied by the skeletal muscle decline in terms of quantity, so the atrophy of the muscle. I think that more in general, every kind of sign suggesting the exhaustion of a function in the individual may have at the basis the dysfunction of mitochondria. In general, in geriatric medicine in particular, we try to differentiate three groups of persons: the robust one, the disabled one, those who are physically impaired in performing in the in the daily life. And there is a gray zone, the so-called frail individuals, those that are at risk of becoming disabled and lost their function, but they are still active and they can still deal with the daily life. I think that this gray zone is really the proper target population for interventions on mitochondrial dysfunction, because they have potential for recovering the health status that they are losing, and they have not yet experienced the huge disruption, multi-dimensional disruptions of the systems in the organism. Mitochondrial dysfunction may lead to different results that are all detrimental for the health status of the individual. Today, most of the literature has focused on the skeletal muscle decline. So the mitochondrial dysfunction may determine a worsening of the skeletal muscle health in terms of reducing strength and muscle mass. This is also because of vicious cycles that are occurring because of mitochondrial dysfunction that are, for example, promoting a low-grade chronic inflammation that is also particularly negative for the muscle homeostasis. I would say that the mitochondrial dysfunction, when will be treated, will be particularly beneficial for those persons who are experiencing the early signs of a physical impairment and they still have the resources for recovering, consequently becoming again active in the daily life. There are some promising data, but there is still nothing that we can identify as a pill or as something that can be provided outside of the traditional lifestyle interventions that are commonly proposed and prescribed by physicians. In particular, there are interventions such as physical exercise, dietary restriction, energy restriction, and adherence to a healthy diet, in particular Mediterranean diet, that have shown very promising results in terms of improving mitochondrial dysfunction. And I think these interventions should allow us in the next future to go in depth in the study of interventions potentially in the future proposed with pills or supplements that may interact with those same mechanisms that are at the basis of the cellular aging. There are studies that have shown that these interventions are particularly helpful at preventing disability in frail older persons. That is, in persons who are presenting some physical impairment, muscle weakness, potentially sarcopenia, but they are not yet disabled. This population that is therefore at risk of becoming disabled, but potentially has still the resources for recovering, is a population that may incredibly improve when the underlying mechanisms like mitochondrial dysfunctions are treated and corrected. I think it is important to identify the signs of mitochondrial dysfunctions, and this is not very easy. I mean, general practitioners, healthcare professionals are not used to identify and going in depth in the evaluation of symptoms such as fatigue, muscle weakness, physical impairment, largely because they have no interventions to propose once the sign is detected. Nevertheless, these are symptoms that are burdening the individual, they are burdening healthcare, public health more in general, and they are highly prevalent. So the first step perhaps is to increase awareness about those neglected signs and symptoms related to mitochondrial dysfunction, again, fatigue, muscle weakness, physical impairment, because recognizing them will open the door to a new way of practicing medicine that is very focused on the patient priorities and needs, in parentheses, the functional ability of the individual, and will improve also the economics of healthcare. In conclusion, I think that mitochondrial dysfunction represents a very promising mechanism for developing new interventions for the management and prevention of age-related conditions. Mitochondrial dysfunction is at the center of many mechanisms responsible for the aging of the cell and therefore of the organism more in general. So correcting and increasing the quality and quantity of mitochondria will probably help us at better tackling the age-related conditions that are burdening the person in his quality of life and functional status, but also the public health system, which is really overwhelmed by dysfunctions and the costs of disability in older persons.